Hello, I'm Toby. I'm Chief Executive of Sandwell and West Birmingham NHS Trust. From the 5th of July, we've gone smoke-free. That means that across all our sites, it's no longer possible for visitors or patients or our colleagues and staff to smoke on our sites. Really, we're asking people to stop smoking. If you have to smoke, then we need you to go off-site. To support that, we've put in vaping arrangements. That means e-cigarettes are available to buy on both of our main hospital sites. We're supporting our inpatients with what's called inhalators and with nicotine replacement gum and patches. So we're very, very clear that smoking is extremely bad for you. Smoking kills, but the good news is that giving up smoking makes a very real and a very immediate impact on your health. So I'm sat here in the garden of the Trust's Health and Wellbeing Centre. We spend a lot of time and a lot of money trying to support our staff to do difficult jobs and to be well at work. And giving up cigarettes is a part of that story. Now, what I wanted to do was to try and respond to some of the comments I've had from members of the public and from staff about our new policy effective July the 5th. So I've got, for example, Sonia Bal and others who are welcoming our new policy. They're saying it's going to be fantastic to come to work or to be a patient or a visitor at Sandwell or at City Hospital or at Rowley Regis or Lesos and not face the risk of having to walk through a fog of smoke. So good news for Sonia, good news for Jessica as well, who commented on Instagram. But I do understand that for a lot of people posting comments, they're concerned about whether we're going to be able to implement this. They're concerned about the cost of implementation. So we'll be spending a 5-figure sum of money in a £500 million organisation to do something that we think makes a real difference to public health. Smoking is the cause of a lot of admissions to hospital. It's the cause of a number of cancers and other diseases. So we think that the investment is clearly worth our while. We've brought people onto our site who are specialist smoking wardens who've worked in other places to help us implement it. Some of us are wearing red t-shirts as we go live to support the enforcement process, and we've got a crack team of security guards as well. That team of security guards are helped by our cameras. We will be using our cameras, of course, to keep people safe on our sites, but also to look for flouting of the ban. Some people have asked me about the safety of people who go off our sites to smoke. Let's be very clear, smoking is a choice, it's not a necessity. We're providing all of these alternatives, inhalators, nicotine gum, and so on. So anybody who's choosing to go off site will be taking a risk-based decision. Now, we care about our neighbours, so we've provided a lot of bins to clear up the debris of smoking. But as I say, we hope, and the feedback we have from our staff, is that many people will use this change in our policy as a moment when they want to be not just healthier but wealthier and to give up cigarette smoking completely. So our smoking shelters are being converted to vaping shelters. Vaping is approved by Public Health England as a way to give up smoking, as a less unhealthy alternative. And so we're pro-vaping as well as against smoking. David asked me about enforcement. His point on LinkedIn is that people may become aggressive. Now, we very much hope that that's not the case. Within our trust, if people do become aggressive, we have specialist security guards to support those conversations. If somebody's persistent, we do have the power to exclude people from our sites. We have the power to confiscate cigarettes and tobacco. And we certainly have the fining power that we're intending to use as an enforcement tool to dissuade people from smoking. If we're talking about members of staff, my colleagues, somebody who accrued 3 such fines over the lifetime of their career here would, I'm afraid, face disciplinary action, because we're very clear as a trust. We're not trying to discourage people from smoking, we're anti-smoking. We don't see it as a habit or a choice, we see it as something that makes you ill. So we know that enforcement, Kat raises this as well on Facebook, will be difficult and challenging, but we're committed to seeing this through. We'll review how we're getting on after a few days, we'll make changes, we'll make adjustments like any other experiment, and we're going to try and enforce this across our sites. Now, one of the parts of our slogan, and Nikki's picked this up on Facebook, is that this is all about clean air. As a trust, we're moving over the course of the next 12 months to a green fleet. So we're trying to move away certainly from diesel cars and towards electric technology in the transport vehicles and taxis that we use. We've been promoting alternatives to travelling by car. All of our sites have some form of bus turning circle on them, and that will be true of the new Midland Met when it opens in 2022 as well. We're supporting people with car sharing apps if they're members of staff coming to our sites, and we're investing in bicycles and in public transport investment. So we're really clear that we're supporting clean air. We explain in our literature and our website the impact of unclean air on the health of a population, particularly children. So we very much see our smoking drive as part of a wider programme to tackle the quality of air in Sandwell and in Western Birmingham. Not everyone agrees with our policy. Terry on Facebook says he thinks it's unlawful and he thinks it's an undue emphasis, and Terry's not a smoker, as he says himself. Our challenge is we believe this is a worthwhile activity. Smoking isn't like some other habits. Firstly, the health impacts are very direct and very immediate, but secondly, by the nature of smoking, you have an impact on the people around you. Outside our maternity unit at City or outside our children's wards at Sandwell is just not an appropriate place to have a cigarette. So we want you to stop doing that. We want you to move away from our sites. We want you to take a break from cigarettes or quit completely. And our respiratory doctors and our respiratory nurses and our therapists and our pharmacists are very clear that this is absolutely the sort of thing that the local NHS should be spending its time on. While the sun's out, let's make some changes in the lifestyle that we have and the lifestyle of the communities that we're part of, and let's quit smoking for good.